We are conversing today with Chuck Connerly and Lucie Laurian, who are both in the School of Urban and Regional Planning. And I've asked Lucie and Chuck to start by shedding some light and sharing with us how they're seeing this play out at the city level. So either of you, please.
Okay. Well, the way Lucie and I got this conversation started, I think it was in a pause at a faculty meeting of all places several weeks ago. And I live out in the country, about 13 miles from the University of Iowa campus. And it's a small subdivision, but we're surrounded by farms, a lot of them Amish farms. And so, quarantining or sequestration or whatever you want to call it has actually been sort of mild for me because when the weather's good, I can go out and ride my bicycle every day. So I can get the exercise and I don't run into anybody. So, I was just thinking about the fact that even though as an urban planner, we preach the value of density, both in terms of giving people accessibility to employment, reducing the amount of automobile trips, which makes life, if people walk more or ride their bikes more, then they are in better physical condition, they're in better health, and it's better for the planet, it's better for reducing greenhouse gases. Density is good, and that's been a difficult thing to preach, but that's sort of what we've been doing. Well, here I am, sort of glad that I'm out in the country, away from the density. And of course, the image of New York City as being sort of the, that overly used phrase, epicenter for this pandemic is there. And so I was just commenting on the fact that I was feeling really hypocritical about this, and that density all of a sudden seemed like something that I was resisting, that I was appreciating being in a low density area. And this is a debate that's going on. It's not just between Lucie and I, but it's going on. What is the role of density in urban planning now that we have this? And so, Lucie, you had a very interesting response, I think, that sort of got the conversation going.
No, I said not at all. I said you're healthier in a city. Life expectancy is longer in big cities. And it's not really about being able to isolate yourself, but it's access to services, access to hospital and medical care that is much higher in larger metropolitan areas. And I also said, well, and it's not really urban rural, it's about how many square feet can you own, right? So if I'm in a big loft in New York City with access to a rooftop viewing work, I'm in a big city and I have the same features that Chuck is describing, ability to go outside and walk around and here I am in downtown Iowa City, I can do the same. I can ride to the park, walk, that's so it depends how much you can afford, right? It's about what kind of income you have in what location. On a small budget, if you want square footage, you go in the suburb, right? But if budget is irrelevant, you will live better and longer if you are the super millionaire downtown in Manhattan, right?
Mm-hmm. But that's so elitist, Lucie. I mean, it's basically, cities work, but they work for the elite.
It's about square foot. It's not about density. Your quality of life is about how much square foot you have access to.
And Chuck, you were just commenting on how this is echoing from historical notions of cities and illness.
Right. Yeah. I mean, when I teach my course in history and theories of planning, we talk quite a bit about American urban history, and we talk about the fact that in the latter part of the 19th century, as cities grew and grew, the suburbanization began. It didn't begin after World War II. It really began in the latter part of the 19th century. It's a reaction of the elite, again, to being near high density situations where there were lots of people who were getting sick because there were communicable diseases like, cholera, et cetera. And so one of the responses was the elites moving, particularly to streetcar suburbs, or actually more like railroad suburbs, like around Chicago, the Winnetkas and the Wilmettes and the Oak Parks and all these suburban areas that were developed in the 19th century, fed by the railroad, but partly because people were running away from the density of the city and running away from the disease, and going into a country, what they viewed as a country kind of situation where the air was fresh and presumably was the disease was not going to be present there. There were other reasons for this as well. It was, part of this was really sort of white flight, sort of a racist response to people moving into the city, as well as concern about fire and other things. But generally, the city was viewed as the place where there was contagion, and so I always, in teaching this class, I sort of thought that some of these reactions on the part of the elites were a little bit quaint. In part, part of it reflected moral concerns about moral depravity, but part of it concerns about diseases that we don't think about anymore. We don't think about epidemics or pandemics like people who lived in cities did. But now it's coming back, and it's sort of like, is there going to be a reaction against the city once again? I mean, a lot of Americans are pretty anti-urban to begin with. And is this going to produce a reaction against the city? And in a sense, we've been trying to grow concern about climate change as the existential threat, which it still is. But if pandemics are a threat as well, they're going to be more of a clear and present danger. And if they do succeed in driving people away from the city, then we've failed, and we're getting even less ready for dealing with climate change. So those are sort of my concerns and my fears, and so Lucie, take it.
Yeah, well, the data is really interesting on that. So obviously, if you're in New York City in a condo situation, apartment, you have the stair railways. It's hard to insulate it. It's hard to not touch anything that somebody else has touched. So the physical density, whether it's in your apartment building, whether it's on the subway, on the bus, yes, high urban densities make it very hard for anyone to isolate in social distance. So I think we are seeing the real impact of cholera-like type of situation where urban density does create hotspots. That's true. I mean, I don't think we can deny that. But on the other hand, if you look at small towns, right, who are less dependent on transit systems, they're also getting hotspots, right? Iowa, South Dakota, we're getting hotspots. They're different. They're not subway hotspots. They're meat packing plant hotspots, right? But we still have them. And there's
nursing home hotspots in a state with a lot of old people.
Yeah.
Right. And that tends to be more in rural or smaller town communities, or tends to be older. So I think when the data shows that there is really no protection, going to a low density situation does not protect you. But I'm not saying that being in New York is healthy. You're taking the subway every day is something that'll keep you healthy. That's not the case. But overall, if you take all the factors of age, access to healthcare, everything combined, then there is really no protection in being in a rural area. So small towns and Iowa is probably a really good case for that. We feel safe. We're very much behind the curve. If you look at the New York Times graphic, we just entered that graph a week ago or so. So we're behind. We're not seeing too many deaths, which is really wonderful. But it doesn't mean we're safe. It doesn't mean we're protected. The 1918 epidemic, the Spanish flu, right, went from Philly, Boston, when they celebrated the war in these big parades, and jumped to Chicago by train, jumped to San Francisco by train, and then entered the rest of the country. And small towns got the flu, and we're getting the flu here in Johnson County. So there's no protection, but having good access to healthcare services, that's the best bet we can once we're safe, obviously. So the data shows that the psychology of rural is better, suburban is better, because I can isolate myself. It actually doesn't pan out in practice.
So taking this in a slightly different direction, yesterday, I think, was when Trump said the governors have the authority, that they're the ones who are going to decide when to open. So how does that play out? What is the role of mayors and county in this? And how is that process for these next few months looking to both of you?
Do you want to start on that, Chuck, since you had a couple of thoughts on that?
Yeah. Obviously, mayors and local governments are very important to that. In this state where we live, I'm not sure to what degree they are being consulted. I know, for example, the mayor of Iowa City had been wanting to have a stay-at-home order issued weeks ago by the governor. And that has not happened. There is now, it's sort of what she's adopted is sort of a regional approach, which is an interesting approach in part because I think she's attuned to the politics of the fact that some areas are getting harder hit than others. And therefore she doesn't want to impose any kind of statewide mandates above and beyond what she's already called for. So the result is that Iowa City, which has been trying to go in this direction for weeks now of having a stay-at-home order, is apparently prevented by state law from doing so. We know that in other situations, other states, cities have greater freedom to do that. In Sioux Falls, South Dakota, apparently the city there where that meatpacking plant is located saw this huge spike. They can issue a stay-at-home order, but apparently there's a 7-day waiting period or grace period, not really a grace period, and they need it right away. And they're pleading with the governor to do that, and the governor is saying no. We have everything that we need in response. Again, even though this is South Dakota, which everybody sees is a rural area, South Dakota is a city, and other parts of the state are much more rural, and you have this sort of really rural urban tension playing out, and we know that plays out. It's obviously people who live in rural areas, don't necessarily think highly of New York City or even Chicago, but it's not even clear that they think highly of the cities in their own state, like Des Moines or Iowa City. And the other thing that gets mixed in with that sort of rural urban is the fact that Iowa is no longer 99% white like it was for 100 years or so. It's still mostly white, but there are growing numbers of African Americans and Hispanic and Burmese and other refugees, and yet they're concentrated in certain areas. And so we know about the breakouts in Columbus Junction and Tama County as well as the one in Sioux Falls, South Dakota. But for people who live in, homogenous areas, they may say, well, that's really not our issue. We shouldn't be restricted just because those people who live in those areas are restricted. So there's this othering that's going on as well, not only rural urban, but also, effectively white versus non-white. Interestingly, listening to I think it was was it the sheriff or the police chief of Waterloo this morning? Maybe it was the sheriff, very unhappy with Tyson's in that plant. Black Hawk County had a relatively low rate of at least reported COVID viruses, but now it's just shot up. And the representatives of the Latin American community, LULAC, Joe Henry, have been talking for weeks about how meatpacking plants are particularly precarious, because people have to work so closely with each other. It's bad enough that it's a dangerous, difficult job that's not well remunerated, but then it's now even more dangerous because of the illnesses that are taking place. And actually that gets back to the point of density. Yeah, we're a rural area. Yes, Louisa County is very rural, but in the context of a meatpacking plant, 1,700 employees, it's very urban, and yet the county does not have its own hospital.
I think the cities are actually fairly well prepared to handle disasters because of previous disasters they've had. So we've had, 9/11, we've had the flood of 2008, we had the flu, we have the, floods over time. So the cities, but also the university, all major institutions have had a chance over the last decades to prepare for disasters. And they look different, but a pandemic is one of them that we've been preparing for. So there is actually, I think, a really high level of preparedness of identifying the threat, collaborating with or against the state, with or against private employers. I'm not saying it's all smooth, but I think cities know who are your partners in that story. The cities are also talking to each other, right? So whether it's a League of Cities or Conference of Mayors, They learn from each other, they exchange, they have these very strong networks. So that multi-hazard preparedness, I think, makes us really strong. So I would guess, and I haven't been part of the operations, but I would guess that the day the city hall closed, they already knew who stays and who doesn't stay. What's a minimal bus service we need to provide? The employees that do payroll, do they keep coming to work? Hey, that was probably already decided because of prior preparedness efforts. So I think our cities are in a really good position. And what we see in Iowa City, I think, reflects that we respect these rules well, even though they don't come from the state level, right? And there's a very strong distancing, there's strong messaging from the city, the playgrounds were closed, etc. So I think we're in a good place because of all the previous hazards we've encountered, and that it forced us to plan collectively. One thing that's different here is that social isolation piece we've never had before. So for flooding, you come and you sandbag, or you buy back some houses that are in floodplain. But we've never had the situation where the order is stay home. So the impact on abused women and children is not something we'd ever seen with other disasters. And here I see the city respond really well with nonprofits, right? Trying to say, well, can we provide more shelter? We understand there's an extra problem we hadn't envisioned in these prior plans. But I see our town as being very proactive and identifying quickly what are the issues that we hadn't seen, coming, and how can we act. So I'd say, like, abuse of children and families is one of the ones that was not in the other plans, and maybe in the future will be. I don't know.
Yeah, and something you touched on as we were talking earlier that I thought was really interesting is that cities are direct delivery systems. And so how, as we're going forward, kind of trying to come out of this, and you're talking about some of the economic effects and how cities, their own internal economies work, and then how that will affect the rest of us. If you could share some of that, I think that's very useful for us to hear.
Yeah, I can do that. So cities' budget rely on a mix of three types of taxes: sales tax, income tax, and property tax, right? If your city relies mainly on property tax, they're paid twice a year. You probably already have the money in the bank this time of year. So say most of the California cities rely mainly on property tax. Their budgets are fairly stable, right? And they may see an effect in a year, in 2 years, if there's a deep recession and property values go down, right? That's possible. But for now, they're okay in terms of their budget security. But cities that rely heavily on sales tax and income tax, like a lot of big cities in Ohio, are losing a big chunk of their budgets right now, right? Because they collect every quarter, right? So Columbus, Ohio is losing 75% of their city revenues. Like, that's huge, right? So it's really the Rust Belt, Ohio, all the way into Maryland, Pennsylvania. There's a zone of cities that tend to rely more on local income tax, and they're not getting that in because the restaurants are closed, the bars are closed, and all these businesses are shutting down, so they're not paying their taxes. So that's going to be a big issue for a lot of cities. There's a list of the worst impacted by the COVID cities you can see, but you'll find there mainly the Ohio, Maryland, but Colorado cities, a couple of them also have decided to go that route. So their municipal budgets are just going down very quickly. If you add to that building permits, park rental, casino income for some cities, or your parking meters, your court fees, all the stuff that go into building up a city budget, all those are basically eliminated as well. So it's not just one of the main chunks, but also the smaller parts of the budget that can be basically at zero right now. So there's a lot of layoffs and furloughs. But I heard, I think it was the mayor of Columbus, I think so, was saying we don't know that we can come back to regular services even after that. Maybe we won't reopen some parks because the cuts to the staff are going to be so dramatic. Everybody overseas is trying to protect fire and police, but everything else, parks, recreations, that might go away.
Mm-hmm.
The layoffs, I think about half of the large cities are planning layoffs right now, based on that survey of the National League of Cities. And furloughs for sure, that's more than half are planning furloughs, but complete layoffs, and that's going to be dramatic.
Mm-hmm.
Yeah.
And I've not heard much from cities. I'm sure they're out talking. You hear mostly from the governors, frankly, in this particular situation. Obviously, Andrew Cuomo talks about that a lot because he's really the most visible, the most vocal of the governors. And, you know, he talks about the fact that in trying to lobby Congress to provide direct aid to states, and I think one could read cities into that as well, it's difficult to do. You know, the majority in the Senate and a large minority in the House understand assisting businesses. But the idea of assisting governments, I mean, you have a group of people in Washington who have been attacking government at least since 1980, and now you're going to quote unquote bail government out. It's again, there's a reckoning here. The Grover Norquist of the world that believe that the fewer your taxes, the better off you are. How do we cope with a crisis where cities can't even provide basic services, and they're going to have to make some tough choices about what they would provide. You know, does this mean a reduction in the police force, reduction in the fire department? Some basic services that touch people's lives are being threatened by this. Yes, of course they need outside assistance. If their entire tax base is being hurt by this, then how effective are they in lobbying Congress? This is really a big moment for the future of cities, particularly as governing units. I think Lucie is absolutely right about that.
Detroit is a good example because Detroit was going through a crisis 10 years ago, right? It's been a while, they've been in decline, and then they went bankrupt. So Detroit has had a particular financial stress on their budget for years, and they got some support. They got bailed out, right? As a result of that, I think they put together a nest egg or a rainy day fund. I'm not sure exactly the amount, but it's there. And they've been able to count on that to fill in the gap in their budget in the past few months, right? So Detroit has lost millions, I think 350 or so million in their budget, but they had that cushion, right? And they had that cushion because they went through a crisis earlier. So, and like I said, a crisis makes you stronger, right? A disaster makes you more resilient as well. So they had that cushion. So I think right now they're laying off, sending some pay cuts, but I don't think they're laying off permanent employees, just the seasonals at the summer parks and mowing, and I don't think they'll be hiring those. But they're not seeing the great cuts. New York, they're saying the budget impact could be 5 to 10 billion. You can't account for that just by cutting jobs, right? So they're probably going to need some kind of federal bailout of some sort. It's too early to tell. But some cities are in a good position if they have that savings. Iowa City actually has a very strong budget so far. So again, you should talk to Jeff Reno, ask around, but I assume we'll be actually okay, right? But some place like New York, there's no way they can fill in that gap. It's too big. The CARES Act, the $2 trillion big federal CARES Act, does have a bit of money earmarked for cities, but they're only cities over 500,000, so small towns won't have that. And even then, it's only for COVID response. So buying masks and supplies, but it's not going to be compensating for lost revenues. So like Chuck says, it's hard to imagine the federal government coming in to provide budget for daily managing of city budgets, but Detroit may be a model for that.
Yeah. So I want to wrap us up with a question that is maybe a little more hopeful. So Lucie had sent an article that I think was in the New York Times, and I've seen some other similar ones, and I'll put it in the notes on the YouTube to link to it. But about some of the positive changes that could come from this, and some things that have already been either tried or suggested. And maybe if you could each reflect on just, you know, one or two favorite ideas that you're hoping might be a repercussion of this.
Well, one of my favorite books that I have students read every year is Jane Jacobs' The Death and Life of Great American Cities, written in 1961. She's an extremely prescient person. And one of the things she talks about is that sidewalks are too narrow and streets are too wide. And this is exactly what's going on in these communities. They're basically taking, in order to enable people to ride their bikes, there's less automobile traffic. So why not let people take advantage of that? Why not use that excess capacity purposely, especially in a way that enables people to get out and get exercise and stay healthy and stuff like that, whether it's walking or riding a bike. And I think this is, the question is whether this is only a temporary situation or not. Well, we don't know when this is going to end. We don't know how long the social distancing of some sort or another is going to last. So this is clearly something that's not going to be over with soon. And so the longer it lasts, the more hopefully people will adapt to a new situation where they are able to ride their bikes. In Minneapolis, I think it was a couple of winters ago, they decided to plow their bike paths in the wintertime. Well, if Minneapolis, with its climate, can enable year-round biking, why can't other places as well? Obviously, you need people to plow those sidewalks, and if the city's hurting financially, then that's another issue. But this is an opportunity for people to experience being in cities in a way they haven't, less reliant on the automobile, because there are just fewer automobiles on the street.
Mm-hmm.
Some examples that Chuck's talking about is Park Avenue in New York, and that is now all for pedestrians so that people can go out and maintain that distance so don't crowd out on the sidewalk. And the other one is in Bogota, Colombia, where the mayor ordered the opening of temporary bike lanes to discourage people from taking transit and stay on their bikes and have more space. So she used, it looks from the photos I saw, about 1 lane of car traffic and a half, something like that, or going into the second lane. So not quite 2 lanes, but it looked like 1.5 lane of car traffic dedicated to bikes in some areas that didn't have bike lanes before. That being said, they were already adding bike lanes over the decades, so it's part of a longer term effort. So they've been already pushing that direction. But for New York, that's completely new. I mean, to close Park Avenue for traffic and say that's for pedestrians now, that's really a big change of. So like Chuck, I think maybe there'll be a change of expectations of what could be the city. If I've experienced that for a couple of months and I could walk on that street and enjoy it, maybe the expectation is that, well, maybe it won't go all to traffic, maybe only half, or maybe 1 avenue north-south or 1 east-west here and there could be dedicated to pedestrian use. I think it may create imaginaries that are appealing, and so perhaps there'll be demand for those. It could be temporary, like these, every Sunday that street is closed to traffic, only bikes. I mean, I could imagine I don't know that Park Avenue will be car free forever. I doubt it. But perhaps on Sundays, or perhaps on the weekend, or perhaps in August, right, there might be some changes that people would be more likely to ask for because they've experienced that, and enjoyed it. There's also other positive impacts. I mean, there's cleaner air, obviously. I'm sure you've seen pictures of San Francisco, LA, bright blue skies, no fog. Again, that could change people's expectation. I saw the sky blue over my head. Maybe I don't want to go back to what it was before, or Delhi, right? I don't know if that's possible, if that's temporary. It's hard to imagine LA without cars. But it may change expectations of what a sky should look like in my town. There's cleaner water. Like you've seen pictures of Venice, right? They can see down the bottom of the canal. They're very shallow. Maybe that's easier to manage, because if you get rid of a few of these very, very big boats, like the big cruise ships that come through the Grand Canal, that was not raise all the sediment. I mean, shallow boats are okay in Venice, but the big ones bring up all the sediment into the water, and it's possible that they'll change their laws and say, no, we want to keep that clean water. I don't know if they will, but at least they've seen it, right? So if for a generation people say, oh, a canal looks gray, that's just what it is. Well, now they know that it doesn't have to look like that. I think that has a lot of potential. Another change is wildlife in cities. So in Wales, there's wild goats going through towns. In Brazil, there's some busy beaches that have sea turtles nesting and coming out of the sand. I mean, these are moments where we realize that, oh, after all, wildlife can be sharing space in cities if only we're quiet, if only we remove the people a little bit from those spaces. And even in the zoo, the Hong Kong pandas just made it naturally after 10 years of not wanting to do the deed. Like, when it's quiet, they do it. And so I think these are right. It's sweet, it's cute, right? Who doesn't want pandas to have baby pandas? I mean, but so the sense that if humans kind of retreat a little bit, stay home more quiet, wildlife will be at better ease, and we'll start doing things that wildlife does, right?
I think
they're positive.
is a good way to end.
All right.
So I'm going to hit our stop. Thank you so much, both of you. Thank you.